A day ago, they declared a critical incident here at Basingstoke Hospital. The response? A rapid repurposing of rooms to free up beds. This physio ward now a waiting area for patients ready for discharge.
We run generally as about 400 beds on each site. They are all full. I've obviously got people coming in and out of them every day. We've had to turn most of our surgical capacity now over to medical capacity to be able to support those patients, and we have opened extra areas.
Susan Hilliard is grateful she's going home after a stressful stay.
It was quite upsetting because there were just so many people who were ill. It did cross my mind, were people there because of COVID or flu? And I did wonder if it was flu, should they just be at home and recover at home?
Basingstoke is one of a dozen hospitals declaring a critical incident this week, all under pressure and overwhelmed with demand outstripping capacity, including the Royal Liverpool, where rising flu cases are to blame.
A nurse just came out and announced the situation today was that there were approximately 220 people waiting for different treatments, but that, it's not all going to one consultant or whatever, and that they've got a lot of staff off sick, so just bear with us.
This winter crisis was predictable, reflecting a wider problem. Hospitals are struggling with services permanently under strain.
When you've got a fragile system, anything that adds to the load could tip it over the edge. And so that's why it's been so challenging. It's worth remembering that flu levels are 246% higher than they were last year and at the same level as the year before.
Basingstoke hopes the critical incident will be lifted by the weekend. But others warn the worst is still to come, with winter viruses yet to peak. Laura Bundock, Sky News.